Hello all, welcome to another episode of Orthodontics in Summary. Today is the first of our four-part series looking at the Invisalign European Scientific Symposium, which took place on the 15th and 16th of May. Now, it's divided up into four sections. Today I'm grouping together two of the presentations that looked at deep bites and the use of Invisalign. So the first talk was by Alessandro Mario, who's from Italy, who spoke about changing the paradigm of deep bites. And he described how aligners work to resolve the deep bite, and there are three mechanics to that process. The first is by using anterior bite turbos, or the so-called. The first is to use anterior bite turbos, or the G5 protocols as also known, to create posterior disclusion, allowing posterior eruption to take place, intrusion of anterior teeth, and the use of pressure areas. Now, pressure areas are interesting. They relate back to how aligners work. They are a push appliance. So, for example, to intrude the lower incisors, there's an intrusive force on the incisal aspect, but also a pushing force from the labial aspect going in the lingual direction. It's going to retrocline the lower incisors. So a pressure area is an indentation which pushes from the lingual side, countering the labiolingual force, in effect nullifying any retroclination or proclination, allowing therefore the force to act along the long axis of the tooth and allow true intrusion to happen. What's interesting, he mentioned about the bite ramps, how they start off gingival initially with Invisalign and they move more occlusal, so it's a progressive improvement of the posterior disclusion. So what did he do? So his study was looking prospectively at 44 patients who had deep bites, and deep bites were classified as 7mm or greater, so a severe deep bite. What did he use? So the treatment protocol that we used were the G5, which involves having bite ramps, lingual pressure areas, which are automatic with Invisalign, use of class 2 elastics. Now, when it came to the clinch check, he planned for posterior eruption of 1mm. In the lower arch, in the premolar region, he had large horizontal rectangular attachments, and he aimed to have heavy posterior contacts take place occlusally at the end. Now, he said this is a usual area that people miss out on when it comes to deep bite cases, and it allows further posterior eruption to take place. Interestingly, he didn't plan for any overcorrection to occur, which is different to Maz Moshari's advice at the AAO, where he tends to aim for anterior open bite when it came to his cases. So what did he find? Well, he found that in all cases, the anterior open bite was resolved, of around 3.5mm. Interesting, the time it took was only 11 months to achieve this with 26 aligners. Now, the second study was by Dieter Brothag from Germany. Now, his was a retrospective review of deep bite treatment. He looked back at 50 patients. Half were treated with Invisalign and half were treated with fixed appliances, both non-extraction cases and with the same deep bite patient category. Now, what did he find? Well, he was looking at how effective the treatment was. So he looked at PAR changes and the duration. For PAR changes, there was no difference between the two appliances, both aligners and fixed. They went from around 20 in the PAR scores to around 3 or 4. But the duration, again, was interesting. Fixed appliances took 30 months and aligners only took 20 months, which was statistically significant. This was also similar information to the paper from Gu from 2017 and Anterior from 2018, showing that aligners are as effective when it came to PAR scoring and more efficient than fixed appliances. They were both interesting studies. I think it would have been great if in the latter study we could understand why the fixed appliance cases took 30 months on a non-extraction basis. In the UK, typically it takes 14 months to treat fixed appliance cases, and that includes extractions. And in the first paper, it would have been great to work out, well, how did they resolve the deep bite? Was it through posterior extrusion as they had planned, or was it through anterior intrusion? As we know from the systematic review from 2015 by Rossini, the extrusive movements tend not to be predictable, at least they weren't at that point in time. But overall, both of these studies showed that aligners are effective at treating deep bite cases. However, we need to bear in mind that one was a prospective study and one was a retrospective study. Neither of them were randomized controlled trials. That's it for another episode of Orthodontics in Summary. Look forward to tomorrow's episode, where we're going to look at the Class 2 cases that were discussed at the Invisalign Symposium. Please do subscribe, and look forward to tomorrow's episode.